Happy Friday, everybody.
Happy Friday to you, Lauren. Thanks so much.
Thanks.
Well, it is 9:34. Right now, we know that the CDC estimates about one person every 5 minutes dies from an overdose. And in 2021, the number of overdose deaths hit a record high in the United States at more than 107,000.
And this morning, we're looking at the impact of the problem here in Connecticut, from parents struggling with loss to our neighbors battling addiction and those trying to help. Fox 61's Keith McGilvery is live at the Root Center in Hartford, where people dealing with addiction can get the necessary help and services that they need.
Yeah, Erica and Tim, good morning. The work here incredibly important as that journey continues for so many. This place knows that world well. Joining us new this hour, Dr. Joseph Podolsky. You are the Chief Medical Officer here at Root. Thank you for having us.
It's a pleasure to be here.
Folks are hearing these numbers at home. There were some 1,500 overdose deaths in Connecticut alone last year. So far this year, more than 160. I know that it is a complicated scenario, but what do you make of those numbers?
Yeah, it's been a difficult few years with COVID. I think people have been more isolated than they might have been. They've been isolated from family and from their providers. We've also found a lot of comorbid mental illness has come out in the past few years. Fortunately, at Root Center, we treat depression, anxiety, along with addiction. So we've been able to refer people appropriately. And lastly, I think we've had trouble with people getting access to care and getting access to care in a timely manner. So our leadership has really made it paramount for us to get people in the same day service with our providers.
I think one of the bright spots maybe about this recovery, there are so few, but maybe the fact that people are talking about mental health a little bit more. How key or how crucial is that component to the work that we're trying to do to try to get folks the help that they need?
It's extremely crucial. There's a lot of stigma historically with mental illness, and I think that is going by the wayside. We do a lot of community organization. We do a lot of community projects to get awareness out there so that people don't feel burden or any kind of societal pressure to not get treatment.
All right, we are in the clinic this morning. I want to give you a look at what is happening here. Kim, you have helped run this show for a number of years. For folks who may need help and the services you're providing, walk me through a little bit what is happening here this morning.
Okay, so here we have the patients getting dosed, and they come up to the window and they state their name, their dose, and their date of birth, and they have a picture ID. And then they give it to the nurse, and she will pour their dose.
And the folks here on the front lines, they were incredibly friendly. The folks who are coming up to the window seem incredibly appreciative. They're already saying hello to us this morning. What might you say to somebody at home who is seeing this story and might be struggling on their journey with a substance use disorder? What do you want them to know?
Take the first step. Come on in and come down and sign up for treatment. We have open access admission. We will assess you, and you'll meet with a counselor the same day and be medicated. We treat you like your family, and we will work with you starting where you're at and get to the bottom of your issues, to the core, the root of the problem.
What do you think you appreciate most about the work that you are doing? This work, probably not for everybody, but you have a passion for it.
Yes, when you see clients doing well, or they come back after they've successfully tapered from methadone and say thank you, or even those who aren't doing well and they reach out and say, hey, can you help me? Can you help me get back in? I'm afraid. And you just encourage them to come back and start over.
It is a powerful message. It is an important mission. Doctor, I might just ask you, there is so much to this puzzle here. Where do you think folks are largely missing the mark? Is there, if you had a wish list, if you had a magic wand, kind of what do you think could make the most impact in tackling this issue?
I think, as I stated earlier, there's a lot of comorbid mood disorders and anxiety disorders. People don't choose to become addicted to heroin or benzodiazepines or alcohol. It's usually some form of self-medication. So I think identifying those comorbid mental illnesses and then referring appropriately and getting people the treatment that they need is paramount.
All right, a unique perspective that you folks are both sharing with us this morning. We appreciate your welcoming us inside your clinic. Do want to point out, stick with us if you can, because coming up new in our 10 o'clock hour, two individuals are bravely sharing their journey with us. They have come here for treatment, their message about what that has meant to them, and maybe their best advice for somebody who might be struggling this morning. It is an important conversation. It is continuing all morning long, only right here on the Fox 61 Morning News. Tim and Erica, back to you.
Okay, Keith, thank you so much. Great work they are doing there. All right, plenty to get to here on Fox 61. Our own Lindsay Kane is cooking with her mom next.